Well, the first advice I have on a student going on practicum is you have to be there early as you can. Um, 30 minutes would be good. 15 minutes is okay, but for the first day, I advise you should go there 30 minutes before, so you get to know maybe one or two people, because basically when you get to the site, you don't know anything, right? So they're gonna lead you to where the lunchroom is, the lab coats are, and they're just gonna tell you to stay there for a while until the LA2 comes to get you, and you'll be on your way for the whole day. When you're doing your job, it's very important the first day you make a good impression. Um, Having a good impression the first day, it makes it easier for you to constantly make it good. Because if you do a bad impression the first day, the second day you'll be like, oh, I did bad yesterday, and you're just gonna keep thinking about it. And you're gonna do bad the whole week, and it's gonna take you a while to bounce back. And it's always good to have a first very good impression, so that when the supervisor asks your coworkers, how does this student do? Is he good, or is he goofing around? So that's definitely one of the best things that you should do, make a good first impression. When you get to your site and let's say you're done your first week, you're gonna see a lot of stuff there, but you need to remember that you're a guest in the site, and it's not your job to tell anyone what they need to be doing, especially in following the SOPs. You just need to do your job and make it your responsibility to learn, because that's the primary thing of your practicum. And you don't really have to worry about the people not following the things that should have been followed in the book, because that's the supervisor's job to come in and do some competencies on the staff, and they rate them, and basically that's what their job is, so you don't really have to worry too much about that. Managing relationships with the preceptors you have in the site, because to be honest, the venipuncture procedure is important, but the thing that will get you hired within your practicum is how good your relationship is with other people. That's one of the things when you get interviewed for the real thing, they're gonna ask you, and if we ask the coworkers what they think about you, what would they say? So you have to think about that from day one, and you have to think that having a good relationship with others, especially the ones who are going to be hiring you, that's actually the key ingredient in getting hired and getting the job at CLS. I mean, I've missed a lot of veins throughout my practicum. From day one until the last day of my practicum, I've missed a lot of veins, but I just made sure I followed what's in the book. But I think the key factor that got me a lot of interviews before the end of my practicum was because I had great relationships with everyone that I worked with, even the hard ones. And that's how you extend your patience and perseverance in the workplace. And it goes both ways as well, like how you manage your relationship with the patients and your coworkers. Because the patients, they can actually have power in that as well. They have this thing in the lab where they can write compliments or complaints for someone, even if it's a student. So if you manage a good relationship with everyone there, it would be a big bonus, especially in getting hired.
Don't be nervous. Be at ease. The employees from CLS really make you feel comfortable. And by the time you're finished, you feel like you've been there for years. Just keep in mind that the CLS employees have been there, years, months, and it comes with time. Your speed will come with time. Don't be rushed. Just be comfortable in what you're doing. I'd have to say pay attention. You're not going to remember everything that you were taught in school, so just pay attention to what they're showing you and have fun. Enjoy yourself. It's a great career, but in the same time you can have fun, get to know people, and be friendly.
I think the most important for a student like me or any student that is going to practicum is to have the, number one, the initiative to, you don't need to wait for things to, give you an assignments, but you have to offer yourself or in fact do a little extra effort of doing things. And number two, which I really learned a lot, I had a probation before because with a valid reason, but I've never been absent in my practicum. Attendance is number one. They have to have a good impression on that. I mean, my last practicum in Sheldon, they really took credit my initiativeness because I don't wait. I stock up on some supplies. I just asked where are the supplies are, and they're really appreciative about it. I extended a bit of my hours, and I miss them because like they really consider me a part of their team. Like when it was the last day of my practicum, they said like, you are not just a student here, Janet, but you have been so valuable with us because they did lack some personnel, so they had to pull me out, and I acted as one of them. And thirdly, is what they call is professionalism. It's a very broad word, but one is you have to have the empathy and compassion with the patient. You have to develop that because sometimes when patients come back, because they have like the frequent patients they have like on a weekly basis, when they see you, they greet you, and it's a really nice feeling. And number two, honest and integrity and accountability. Because there are times like, I think I missed out one of the urine pour. I really went to the MLA and said, I already poured out the rest of the urine. What can I do? But I did collect. She said, that's good, Janet, you're honest that you forgot that. But then they made a solution on that. So being with Abes, I have learned a lot from my mentors, from Camille and Joyce, and from you, Julie. And it's really true. What you have instilled in us prior to our practicum is 100% true. And I'm really proud to be an Abes student.
Okay, there are many things, but like, to be very concise, first of all, I would say like, your attitude. The more teachable you are, the preceptor gonna like, be comfortable with you, and they're gonna throw with the valuable tips. So the very first thing is like, how teachable you are. That is the first attitude like, I would like to recommend. The second thing is like, your professionalism, because every internee student is a future employee. So it is really important like, how you show up your professionalism. So if you are really good, if you are really friendly, if you want to be a part of the team, and if you want to show other people, okay, you are a good student, that definitely will help you in the long run. And ultimately they would hire you after the completion of the internship. Okay, and the other thing I would say, you need to respect your preceptor, because if you have a teacher and a student friendly relation with them, they would be really comfortable in teaching you the stuff. But if you are not like, if you don't have a good relation with them, they might not like, end up with like, teaching you, because they are not obliged to do that, because they are not even paid for that. So it is more like, how you build up your relation with the preceptor. The more friendly it is, the more like, there is a chance of like, getting much from them. Okay, and I would also recommend students like, before you begin your day with the preceptor, just let your preceptor do first or second pokes. So that way like, you would know like, how they gonna approach with the patient, and that will like, build up some confidence on you, because you watch them directly over there, rather than like, you start yourself and like, you end up with confusion, and like, your preceptor has to take over. So it's always a best practice like, you say your preceptor to do first few pokes and then you follow it. And also like, the very important thing is like your SOPs, because there are some instances like, when the preceptors, they don't follow the SOPs, they would say, okay, this is how it's gonna work in the real world. But when it's your time to like, do the poke, just follow all the SOPs. That is very critical for the sake of the sample integrity, and for the sake of the, the safety of the patient, and also for the safety of yourself. So it's really a good practice to stick with the SOPs, because this is how you're going to prepare yourself in the long run. If you stick with your SOPs, you'll be fine for the whole time. If you don't follow it, you're going to end up with the problems.
What advice would I have? The first thing is I would advise people to make sure you know where you're going. If you find out on Friday what your location is going to be, Friday afternoon, Saturday, Sunday, get in your car, drive over and find out where you're going to be. Find out where your parking is, find out where your lab is. Even if you can meet some of the people that are in the lab, it's a good idea. That way Monday, when you get in your car and you're driving off, you know where you're going. You're not going to be late. You can walk in, you maybe even have a friendly face there to greet you at the door. Okay, another thing I would suggest too is when you're out on practicum, if you can get with a new MLA every day. If they put you with the same person a couple times, that's fine, that's great. But if you can get out with a different person every day, it works out so much better. You have different experiences with them. They may have different techniques. They may show you different things. You're going to see things that you don't like. You're going to see things that you do like. If it's something you like, write it down in your book. If it's something you don't like, write it down in your book and just don't do it yourself. So when I was out on my practicum, I got a phone call on Friday afternoon. I was sitting at my computer and I was inputting all the information for my journal for the week. And it was somebody from the infectious disease department calling to tell me that I had been exposed to invasive group strep A. I was a little bit surprised. They told me the date it happened, they told me the patient it happened and asked if I remembered, and you're poking so many people you don't remember. So she started telling me a few of the things that I needed to know, that it could prevent or could show up as a rash, as a fever, as sudden pain in my arms or legs. The one thing she told me was it was invasive group strep A. So it's not just a cold or a rash, it's actually the flesh-eating disease. So very, very serious, not to be fooled around with. If you ever get exposed to anything, if you ever go into a room to do blood cultures and you see that the patient is laying there in the bed and they are not looking good, they are coughing and they've got, rashes and their skin's looking bad, my suggestion to you is to put on a mask. You don't have to put on the N95, but at least put on, your medical mask. So that's going to protect you a little bit from anything that may come out of the patient's coughing. Another thing that she told me is if I show any symptoms to go to the emergency room. Don't go to a walk-in clinic. If you go to a walk-in clinic, they're not going to know exactly what you're dealing with. They may get confused with what you're telling them. Go to the emergency room, let them know that you've spoken to the people from the infectious disease department, let them know that you've been exposed to the exact specific strain, the invasive strep A, and don't play around with it. Also a good thing to do would be to contact Ingrid for sure at the DSC, contact Camille and contact Julie as well to let them into the loop so they know what's going on. One more thing regarding the group strep A. When you go into the emergency room, they're going to give you a prescription for antibiotics. They're going to say, if you present with any of the symptoms, please take the prescription. Don't listen to that. Go to the pharmacy right away, fill your prescription, and start taking the medication immediately. Do not wait to have any symptoms. Better safe than sorry. It's not going to kill you to take the antibiotics. It's not going to hurt you. But if you do have the gene or you do have the thing growing in you and deciding it's going to attack your body, this way you're protected. You can knock it out before it gets a ground.
To keep an open mind, be organized, be prepared, be ready to listen to your preceptor, take notes, try to prearrange a time with your preceptors ahead of time so you can have some feedback while you're doing it. Don't wait to the end to get it. And don't take the challenges of other students that are there or present, is what I would advise. Keep that open mind though, and listen. Okay, so when you're in your practicum, I
advise not to engage with the other students that may have been previously in the programs from other institutions to our institution, because you have what's laid out for you and you need to complete that, and they may have got something different, which is great, but you need to finish up what Abes has laid out for yourself. So just complete on that and focus on that, and don't allow the other stuff that's coming around you intimidate you.
Going out on practicum, I would say don't be nervous at all. Be confident in your techniques, in your skills that you learned. Everything's different there, but you just have to have confidence in what you learned from Abes. Ask lots of questions. Listen to everything your preceptor says. What your preceptor or your supervisor teaches you is always valuable. You will always learn it, no matter what. Even if you don't think that you're gonna need to know this information, or if they tell you to watch them, you're watching them for a reason. If you get a certain type of patient, if they want to take you to emerge or something, you're going for a reason. It's because it's for your own best. So always listen to what your preceptor tells you. If they tell you to write something down, write it down. If they tell you to do something, do it. Never refuse them. Always be helpful. That's the one thing that I noticed they really liked about me, is the fact that I would always go and help. I would take initiative. I would take as many patients as I could. I would never just sit there. I would always be on the go. On your spare time, don't just stand there, go and stock things. Always do something. Coming from Edmonton to Calgary for the medical lab assistance program was a big thing for me. I would never do such a thing. However, I did go on the website and I read good reviews about Abes. I know someone that went to Abes a long time ago. Really good reviews, and it was in Edmonton. I heard good things about Calgary and the program itself. Aside from that, it's fast track. So coming to Calgary was definitely beneficial for me and my career. You learn a lot here, and the instructors and everyone are great. They teach you amazing skills and techniques, and I would say it's definitely worth coming to Calgary for the MLA program. I came from Edmonton to Calgary for the MLA program at Abes, which is 14 weeks long. Abes placed me at a practicum in Edmonton, which was great, and I had a great experience in my practicum at Edmonton, and it was definitely worth it. Honestly, I know it's crazy, but I heard amazing reviews about Abes, about the MLA program itself. I heard that the instructors are amazing. They teach you great techniques and skills that will help you in the future. They will place you at a practicum in Edmonton. Aside from that, the one thing that got me to Calgary was the fact that you guys do have partnerships with Alberta Health Services, and with that, I was like, okay, well, I can easily get a job. So that's one of the positive reasons why I chose Abes. Another thing is that it's a fast track program, only 14 weeks long. So with that said, I was like, you know what, I can do it from November to February. It's not that bad. Aside from that, I learned amazing things at Abes, and I would say it's definitely worth everything.
I would tell them, first of all, to keep a positive attitude. Keep a smile on your face. Treat everyone the way you would like to be treated. Learn, be open to everything around you, everything you see, all of the experiences, whether you're in a PSC or whether you're in a hospital. Well, living in Canmore, which is right smack dab in the middle of the Rocky Mountains, about an hour from Calgary, driving back and forth was good because I really only drove back and forth on the weekends. I was fortunate enough to have a friend here in Calgary that I was able to stay with during the week, and then Friday nights, little doggy and I would travel back to Canmore the hour, and we were home for the weekends, and then we'd come back early again on Monday morning for school. So it was good. My practicum was at Canmore General Hospital, which is a small hospital, but there's also an extended care there, and it went very well. The people were lovely. The pace is a little bit slower than it is in the big city. People were great. You know, I had some great teachers there as well, and got to see a lot in the hospital. I think that you know, I think when you go for your practicum, that is really an extended job interview. So I think if your skills are good, if you're confident, you do well, you know, it's definitely a foot in the door for you. That's, you know, that's my my thinking.
Know your SOPs and know them well. It'll help you with pokes and with greeting the patient and everything else. So yeah, know them inside and out. And then my second piece of advice would be to do all the pokes, do all the hard pokes, even if you don't think you can get them, and do them early in your practicum so that once you get to your competencies, you're totally comfortable with them, because you can learn as much from a miss or even more than actually getting the poke. You'll learn what not to do, and you also learn how to redirect and how to reposition, how to re-anchor, all these kinds of things that you will need because they're amazing skills. Talk to your preceptors. Tell them how you're feeling, ask them questions, ask them for advice, tell them to maybe not grade you, but assess you after you've been poking with them. Be flexible, but keep within the SOPs. You will feel at some points like you're being pulled in different directions because different preceptors do things differently. And some preceptors will allow you to do things your way, others will not be that flexible. So find flexibility within yourself, but keep to the SOPs. And listen to what they say and try it out. If it doesn't work out, then you know what not to do next time. Know that Abes is behind you, and if ever you have any challenges or any questions or any concerns during your practicum, send them an email, because they're very willing to practice with you and to steer you in the right direction. And you know, you can come back to school at any point in your practicum and they will be in your corner helping you and guiding you through it.
The biggest one is when your first day, when you get in there, ask what you can do, stay as busy as you can all the time, and don't get caught up in any drama that is going around, because it's just a bad loop. Patient confidentiality is huge, so stick with that for sure. I would say don't be afraid to miss a vein, because you're gonna miss 100% of the veins that you don't go for, but also it'll come when you get going. You'll hit a vein eventually.
I would definitely say to relax. You are going to miss. It's not a big deal. You learn to get better as you go along, but don't stress about it, because you will miss for sure. And mostly just follow your SOPs and ask a lot of questions. If you want to do something or you want to know something, they're there to teach you. And for the most part, they're really good about it.
My main thing to tell someone first day at practicum is patient care. It's amazing what you see on a patient's face when you call their name and you smile, and they're sick, they're tired, they've just waited in the waiting room forever, and you need to take that time to make that rapport with them, because yeah, it almost made me sad to see how they were, and made me happy when they just relaxed, when you finally smiled. They're like, oh, you're new, you're nice. You know, it made it go better. And they're more understanding too. Ask questions, but make notes. Like if you learn something, make a note. At night, review it. You know, you don't want to ask the same question a million times to your preceptor, but at the same time, never assume. Learn your job. When you have downtime, look up stuff. The more you see it, the more you'll remember, and just the more comfortable you'll be, you know?
So my advice is just do everything you can to do your job, to do things right, and just don't get intimidated to other people. If you know you're doing good, or if you know that you're doing the right thing, you're in the right path. if you're taking the bus or if you're driving, if you know that the weather is bad or if it's going to be a busy road, just get up early and be on time. Do your practicum not because you have to, but because you want to.
They have to wash their hands every time they see a patient coming in, going out, leaving. When the patient leaves, they have to wash their hands. That's really important because you don't know what the patient has, and you don't want to spread that to the next patient that you're gonna get. And always read the SOPs. Like they have this unusual test that coming in, and write it on your note. And what I do is I read it every morning. So if ever I see that again, oh, I've seen that. I'm just gonna grab. I know where it is, and yeah, I don't have to ask anyone, which is gonna take their time, take my time, stuff like that. And stats, really important because if ever you miss stat, you have to call the patient again, and you don't want the patient to be called in to be getting poked. They don't really like that. But if it's urine, usually they don't get cranky as much as blood specimens and stuff like that. Yeah. Get a lot of rest. When you get home, probably read a couple of hours of your notes and some of SOPs, but get plenty of rest because it's gonna be really tiring, and they're gonna throw a lot of information when you, same as like getting some unusual specimen logins, how to handle specimens, stuff like that. So yeah, just get a lot of rest.
Hi, I'm from Lethbridge, and I came to Calgary for the MLA program at Abes. I spent 14 weeks here. I was really nervous about coming back to school because I haven't been in school for quite a few years, and I was like 100% excited about my experience here. It was really good, and I felt like going out into my practicum, I knew exactly what I was doing. I went back to Lethbridge for my practicum, and they only usually have state students down there, and they were extremely happy with my ability, and they were shocked, like on my first day, how comfortable I was with poking and everything, and not afraid to get in there and do everything. And yeah. And I've already got a job, and I start Monday, and my practicum just ended yesterday. When you're going on practicum, just don't be scared or nervous, and listen to your preceptor. They know what they're doing, as much as sometimes they're not doing things safely and stuff. Just kind of ignore it and do things the way you were taught, except for sometimes they try to force your hand into doing it their way, and just kind of let them know that you were taught this way, and usually they're pretty open to, because they maybe don't know that that's the way that they were taught.
Just to be friendly, professional, do the best that you can do. If you have questions, ask them, but try not to ask the same question over and over again. I kept a notebook with me, and when I had my answers, I would write the answer down in that notebook if I ever needed to refer to something. If you forgot something along the way, you could just refer to that notebook easily and proceed.
Okay, for students going out on practicum, I would say clear your schedule for 5 weeks. Don't have any other plans or plan to do anything. Don't have like, oh, you know, I have this party or this arrangement or people are coming or things to. Don't. Just give it everything, because you're going to be exhausted every single night, and you're just going to want to go and just learn as much as you can from all of the different people, all of the different experiences. It's absolutely overwhelming, so you're going to need all of that time. So just clear it so you can go to bed at night and then get up in the morning and be fresh. It's not like you're just going to work and you can just leave it. No, you have to go home, prepare for the next day. It's huge, and yeah, just clear your schedule. Okay, nobody bug me for this length of time, and go. Trust me, it's worth it. Just keep asking, know that you're there for you. This is your practicum. This is your education. You know, it costs some money to be here. You know, you really need to know this, especially when you're going to be on the job. You know, it's not, you can't just run to the big book, or you know, you don't always remember everything that you learned, you know, for the exam. This is like real life. It's practical. It's your practicum. You need to know, keep asking, you know, even if they kind of look like they want to punch you in the face. Ask them again until you know it. And then, okay, you can go now. I got it. And
It's worth it, even though it's frustrating. It's terrible. It's grueling. It's grueling. It's so hard out there sometimes. And if you have to cry, whatever, just do it. Who cares if they write you up that you're a crybaby?